Here is a detailed explanation of the topics related to blood pressure, pulse, and circulation, broken down for clarity and depth. 1. Blood pressure and pulse. A. Blood pressure. Definition. Blood pressure is the force exerted by circulating blood on the walls of blood vessels, primarily arteries, as the heart pumps blood throughout the body. Types of blood pressure. Systolic BP, the pressure in the arteries during the contraction of the heart. Ventricular systole. Normal range, 100 to 120 millimeter Hg. Diastolic BP, the pressure in the arteries when the heart is at rest between beats. Ventricular diastole. Normal range, 60 to 80. Normal BP values, adults, normal, 120-80 millimeter Hg. Prehypertension, 121 to 139, 81 to 89 milliHg. Hypertension, stage 1, 159 / 90 to 99 millimeter Hg. Hypertension. Hypertension, stage 2, 160 to 100 millimeter Hg. Hypotension, 90, 60 millimeter Hg. Methods of measurement. Auscultatory method using sphygmomanometer and stethoscope. Oscillometric method using electronic devices. B. Pulse. Definition. Pulse is the rhythmic throbbing of arteries as blood is propelled through them, typically felt at the wrist or neck. Characteristics of pulse. 1. Rate. Number of beats per minute, normal adult, 60 to 100 BPM. 2. Rhythm. Regular or irregular pattern of beats. 3. Volume, amplitude. Strength of the pulse. Strong, weak, bounding, thready. 4. Tension, the resistance of the artery to pressure. Sites for pulse palpation: radial artery, wrist most common, carotid artery, neck, brachial artery, inner elbow, femoral artery, groin, dorsalis top of the foot, posterior tibial behind the ankle. Circulation, principles. Definition of circulation. Circulation is the continuous movement of blood through the heart and blood vessels to deliver oxygen and nutrients to tissues and remove waste products. Basic principles of circulation. The heart acts as a pump to propel blood. Arteries carry blood away from the heart. Veins return blood to the heart. Capillaries are microscopic vessels where gas and nutrient exchange occurs. Circulation is a closed-loop system. Nasher 3. Factors influencing blood pressure affect cardiac output, CO, CO equal BP, peripheral resistance, resistance equal BP, blood volume, volume equal blood viscosity. Thicker blood increases BP. Arterial elasticity, less elastic arteries equals BP. Age, BP increases with age. Emotions and stress, stimulates sympathetic system. Standing can increase BP temporarily. Exercise, initially BP, long-term reduces resting BP. Medications, some increase, e.g. decongestants, some decrease BP, e.g. beta blockers. Nana 4. Factors influencing pulse. Effect on pulse rate. Age, infants have higher pulse, gender, slightly higher in females. Exercise, pulse rate temporarily, fever, infection, metabolic rate pulse. Pain, emotions, sympathetic activation equals pulse. Medications, e.g. atropine, beta blockers. Hemorrhage, blood volume equals pulse to compensate. 5. Circulatory system type A, pulmonary circulation. Pathway: 1. Right ventricle, pulmonary artery, deoxygenated blood. 2. Lungs, gas exchange, CO2 out, O2 in. 3. Pulmonary veins, left atrium, oxygenated blood. Function: oxygenation of blood, removal of carbon dioxide. B. Systemic circulation. Pathway: 1. Left ventricle, aorta, arteries, arterioles, capillaries in tissues. 2. Capillaries, venules, veins, vena cava, right atrium. Function: supplies oxygen, nutrients to tissues. Removes waste, CO2, urea. C. Coronary circulation. Definition: the network of arteries and veins that supply blood to the heart muscle, myocardium. Coronary arteries. Branch from the base of the aorta, 2 main arteries. Left coronary artery, LCA, divides into left anterior descending and circumflex artery. Right coronary RCA, coronary veins. Collect deoxygenated blood from the heart and drain into the coronary sinus, which empties into the right atrium. Function: supplies the heart tissue with oxygenated blood, essential for the heart's functioning. Clinical note: blockage, myocardial infarction, heart attack, treated with angioplasty, stenting, or bypass surgery. Summary table, circulation type starts from ENS, function, left atrium, pulmonary, right ventricle, left atrium, oxygenate blood in lungs, systemic, left ventricle, right atrium, supply body tissues with nutrients, O2, coronary, aorta, coronary arteries, coronary sinus, RA, nourish the heart muscle. Here is a detailed section on the application and implication of blood pressure, pulse, and circulation concepts in nursing practice. Application and implication to nursing. Understanding blood pressure, pulse, and circulation is critical for nurses as it directly impacts patient assessment, diagnosis, care planning, intervention, and evaluation. Here's how these concepts are applied in clinical practice. 1. Vital signs monitoring. Application. Nurses routinely measure blood pressure and pulse as part of vital sign checks. Helps in early identification of abnormalities, e.g. hypotension, hypertension, bradycardia, tachycardia. Implication. Prompt reporting of abnormal findings can prevent complications such as stroke, shock, or cardiac arrest. Guides the need for emergency interventions or adjustment in medications. 2. Cardiovascular assessment. Application. Nurses assess pulse characteristics, rate, rhythm, volume, and BP trends to evaluate cardiac function. Capillary refill, skin temperature, and color are also checked for circulatory status. ASHAN implication. Early detection of poor perfusion, hypovolemia, or heart failure. Supports accurate nursing diagnosis such as decreased cardiac output or ineffective tissue perfusion. 3. Medication administration and monitoring. Application. Before administering antihypertensives, beta blockers, or diuretics, nurses must check BP and pulse. Ongoing monitoring to evaluate therapeutic effectiveness or detect adverse effects. Implication. Prevents medication-related complications like hypotension or bradycardia, enhances patient safety, and ensures medication compliance. Now for patient education. Teaching patients how to monitor BP at home. Educating on lifestyle changes, e.g. diet, exercise, smoking cessation, to maintain healthy circulation. Implication. Empowers patients in self-management of chronic conditions like hypertension, reduces the risk of cardiovascular diseases, stroke, or renal failure. 5. Emergency nursing care. Application. In cases of trauma, shock, or cardiac arrest, nurses monitor for circulatory compromise, implement life-saving measures like CPR, fluid resuscitation, or defibrillation. Implication. Quick response based on circulatory assessment can save lives. Critical in triage and prioritization of emergency care. 6. Postoperative care. Application. Monitor BP and pulse to detect post-surgical complications, e.g. bleeding, infection, shock. Assess circulation in limbs if surgery involved vascular areas or under anesthesia. Implication. Ensures early detection of hemorrhage or thrombosis. Facilitates timely interventions and wound healing. 7. Fluid and electrolyte balance. Application. Assessing BP and pulse for signs of dehydration or fluid overload. Monitoring in patients receiving IV fluids, blood transfusions, or diuretics. Prevents electrolyte imbalance, edema, or circulatory overload. Supports homeostasis and patient stability. 8. Documentation and communication application. Accurate recording of BP and pulse readings, reporting abnormal values and trends to physicians or multidisciplinary teams. Implication. Maintains a clear medical record, aids in clinical decision-making and continuity of care. 9. Nursing diagnosis examples. Nursing diagnosis, related changes from fluid loss gain, ineffective tissue perfusion, poor systemic or peripheral circulation, decreased cardiac output, abnormal pulse BP, heart disease, risk for imbalanced fluid volume, BP changes from fluid loss gain, risk for shock, sudden drop in BP, weak rapid pulse, risk for impaired skin integrity, poor circulation. Holistic implication. Promotes comprehensive patient care integrating physical, psychological, and educational aspects. Improves patient outcomes by guiding preventive and therapeutic interventions. In summary, concept, nursing application, implication, blood pressure, regular measurement, assess trends, guides treatment, identifies hypertension or hypotension, pulse, check rate, rhythm, volume, detects arrhythmias, shock, cardiac distress, circulation, evaluate tissue perfusion, check extremities, prevents complications, supports diagnosis and care planning. Thank you. Have a nice day.